This is our presentation on community practice in the rehabilitation and disability setting. Our objectives for today are to evaluate occupational therapy's current role in working with clients with mild traumatic brain injuries, to understand the role of occupational performance coaching in addressing the psychosocial aspects of mild TBI, and to apply the concepts of occupational performance coaching to current programming available at Midwest Brain Injury Clubhouse. Our article is called Using Occupational Performance Coaching in Mild Traumatic Brain Injury Rehabilitation. This article asserts that traditionally, the focus on rehabilitation for clients with mild TBI has been focused on physical and cognitive symptoms. In OT, this means emphasis on functional living skills, visual perceptual goals, and equipment needs of clients. However, the article also asserts that this approach lacks focus on the psychosocial aspect of recovery for clients with mild TBI, and that sensory, cognitive, and mental and emotional health of clients should also be considered and incorporated into rehabilitation. In OT, this means a focus on vision, cognition, self-awareness, as well as life and occupational roles. The article proposes the use of occupational performance coaching, specifically solution-focused coaching, when developing interventions to address psychosocial recovery in clients with mild TBI. OPC focuses on working collaboratively with clients to set goals, problem solve, and educate clients holistically concerning things that are important to them. This approach empowers the client to utilize their strengths in order to work toward solution-focused problem solving and goal attainment. This psychosocial approach involves the client in their own recovery process while focusing on their strengths and participation. OT should work together with the client to develop a recovery plan based on the client's personal experiences and also evidence-based interventions. In terms of evidence for occupational performance coaching, this approach has been adapted within the stroke population, which also sees more of a symptom and physical focus during rehabilitation. Bannon et al. Completed a narrative summary of existing literature concerning adjustment to mild TBI and presented a framework that incorporates interpersonal and psychosocial factors into treatment of this population. These factors include psychosocial components such as relationship status, roles, social networks, contacts and supports, and communication. It was found that incorporating an interpersonal framework into treatment of clients with mild TBI that includes consideration of these psychosocial factors has the potential to improve clinical practice and provide more holistic treatment of clients. Kessler et al. Adapted the occupational performance coaching method for stroke survivors. They completed a multiple single case study for 2 participants who received 8 weekly 1-hour occupational performance coaching sessions. Intervention began with identification of participant goals using PPA that included rating each project according to characteristics such as the meaning, value, and importance of their projects. Based on these projects, participants then selected up to 3 goals to address during the intervention. Focusing on one of the selected goals, the coach introduced the problem-solving framework of set goal, explore options, plan action, carry out plan, check performance, and generalize. Subsequent sessions involved continued guidance through the problem-solving process with provision of emotional support and individualized education that was responsive to the individual's experience of stroke and related to goal achievement. Both participants experienced improved performance on the COPM on 5 out of 6 goals and increased performance satisfaction in all 6 goals. Dawson and Truman surveyed 151 Canadian OTs to assess if and how psychosocial factors were being addressed in acquired brain injury rehabilitation by occupational therapists in Canada. 99.4% of respondents agreed that addressing psychosocial factors was relevant for acquired brain injury rehabilitation. Based on the examples provided by the survey respondents, most psychosocial interventions following an acquired brain injury were implicit. The article suggests occupational therapists may benefit from education to explicitly address psychosocial factors. Doing it all evaluated the efficacy of client-centered, goal-directed, and environment-focused outpatient rehab following TBI in Australia. This pilot study looked at 14 participants with brain injury and measured them over a 12-week period of time in an outpatient rehabilitation setting. The participants were split into two groups, day hospital and home setting. Patients were in charge of creating their own goals in a manner similar to occupational performance coaching. The program resulted in significant improvements in goal attainment, occupational performance, psychosocial reintegration, and ability and adjustment levels. This article suggests that addressing these psychosocial factors in a similar manner to occupational performance coaching can work with this population. Cahoog et al. Performed a literature review of studies that researched the effectiveness of occupational performance coaching interventions. They reviewed 4 studies. 2 of the studies were with parents of children with a diagnosis or concerns about occupational performance. 1 was with teachers of children with developmental disabilities, and 1 was done with stroke survivors. The results of the study showed that occupational performance coaching interventions improved performance, satisfaction, self-efficacy, and occupational engagement. Although the current research on occupational performance coaching is limited, preliminary studies show that it is a promising strength-based intervention method for improving occupational engagement. We chose Midwest Brain Injury Clubhouse as our setting. Midwest Brain Injury Clubhouse serves adults who have experienced an acquired brain injury. They follow a clubhouse model, which provides day programming for individuals once they have completed therapy. Midwest Brain Injury Clubhouse was created based on the International Brain Injury Clubhouse Alliance standards and the clubhouse model, which is centered on providing rehabilitation through a work-ordered day. The clubhouse model utilizes the members' strengths in programming and allows members to socialize with one another, be productive, and contribute to a common cause. Clubhouse members participate in running the daily operations of the clubhouse and play an active role in clubhouse decision-making. Midwest Brain Injury Clubhouse's mission is: MBIC provides lifelong rehabilitative services, support, and mentoring to persons in our community affected by brain injury and stroke. Their vision is: all persons affected by brain injury and stroke throughout Chicago and its surrounding areas shall receive the services and support needed from our center in order to optimize their recovery, attain their highest level of function, and live productive and fulfilling lives within their community. At the clubhouse, members work together with staff and volunteers in order to do the work that keeps the clubhouse running, which includes answering phones, completing paperwork, preparing lunch, and keeping the clubhouse clean. This allows members to capitalize on their strengths, utilize the skills they have to be productive, and be a part of the community. Members are encouraged to think of the clubhouse as their job, building vocational skills and improving self-esteem and confidence in their abilities with social interaction and productive contribution to the community. Clubhouse programming also includes education on topics such as health and wellness and community integration, with outings to places like bowling alleys and to White Sox games. We think that occupational performance coaching would be a beneficial addition to programming offered at Midwest Brain Injury Clubhouse for many reasons. The first is the need for psychosocial recovery within this group. Midwest Brain Injury Clubhouse does not currently have a specific program in place to work to address psychosocial recovery. In group, Clubhouse members have described experiencing feelings of sadness and loneliness, especially since the onset of the pandemic. Our second justification is to fulfill their mission and vision. The program aligns with the current Midwest Brain Injury Clubhouse mission to support people in the community who have sustained a brain injury. The program will assist in optimizing members' recovery, attaining their highest level of function, and living productive and fulfilling lives within their community. Our third is occupational engagement. Midwest Brain Injury Clubhouse's value statement includes the sentence, "We empower those afflicted by brain injury and stroke through active engagement, work, and purpose." Occupational performance coaching has occupational engagement at its core, and using this model would fit within Midwest Brain Injury Clubhouse's focus on active engagement. Occupational performance coaching uses collaborative problem solving and goal making to empower the individual to feel confident engaging in their meaningful occupations. It fits well within their value of empowerment through active engagement, work, and purpose, and would be a good addition to the services and interventions they provide. There is a need for a program at Midwest Brain Injury Clubhouse to address psychosocial symptoms that members experience, especially since the onset of the COVID-19 pandemic. Occupational performance coaching emphasizes a strength-based, client-centered approach and focuses on collaboration in goal setting and problem solving. Following this evidence-based program, members of the clubhouse should feel more confident in being able to achieve their goals and engage in their preferred occupations, thus reducing mental health symptoms and increasing psychosocial recovery. Implementing the OPC-FSC approach at Midwest Brain Injury Clubhouse will assist the clubhouse in achieving their mission and vision. This program will help optimize psychosocial skills in order for the members to achieve their highest level of functioning and facilitate their integration into the community. Here are a couple of questions for the discussion board. And that's it. Thanks for watching.